You have a medicine cabinet, maybe in your bathroom, maybe in your kitchen, and there is a decent chance that somewhere inside it, right now, is a bottle of prescription painkillers. Maybe from a surgery, maybe from a back injury, maybe from a dentist visit 3 years ago that you forgot about. You did not go looking for those pills. A doctor handed you a prescription. A pharmacist filled it. You took them home because that is what you do when a medical professional tells you something will help, and you never questioned it. Why would you? You trust your doctor. Your doctor trusts the medical literature. The medical literature trusts the pharmaceutical companies that fund the research. That chain of trust is exactly what one family used to kill more than 500,000 people. There is a name you need to remember: Richard Sackler. Remember that name, because in about 15 minutes, you are going to understand why he still has $10 billion and you are still paying for what he did. I am going to show you exactly how they did it. Not in broad strokes, not the version you have seen on a Netflix show, the actual internal emails, the actual bonus checks, the actual training scripts they handed to sales reps and told them to memorize. Because this was not a tragedy, it was a business plan, and it worked better than anyone could have imagined. In 1996, a company called Purdue Pharma released a small pill stamped with the letters OC. They called it OxyContin. It was oxycodone, a chemical cousin of heroin, packed into a time-release formula that was supposed to dissolve slowly over 12 hours. One pill in the morning, one before bed. Smooth, sustained pain control all day and all night. That was the pitch. The pitch came with a number: less than 1%. That was the addiction risk, according to Purdue. Less than 1% of patients would develop a problem. Doctors heard that number over and over. It was the centerpiece of the sales presentation. It was on the materials. It was the answer to every objection. And it came from a letter, not a study, not a clinical trial, a 5-sentence letter published in the New England Journal of Medicine in 1980 by Jane Porter and Herschel Jick. They had looked at roughly 12,000 hospitalized patients who received narcotics under direct medical supervision in a hospital setting and found that only 4 developed addiction. That was it. 5 sentences about monitored hospital patients on short-term care. Purdue took those 5 sentences and turned them into a sales pitch for long-term outpatient prescriptions of one of the most powerful opioids ever sold to the public. They stripped away every piece of context. They never mentioned that the letter only applied to hospitalized patients. They never mentioned that it was not a study. They trained their sales representatives to cite it as if it were settled science, and doctors believed them. Why would a pharmaceutical company lie about something that easy to check? Because almost nobody checked. That letter became one of the most cited publications in medical history. Hundreds of subsequent papers referenced it, almost always to support the claim that opioid addiction was rare. Almost none of them went back to read the original 5 sentences. But Purdue did not stop at one misleading statistic. They built an entire ecosystem designed to make doctors prescribe more opioids and feel good about doing it. In 1995, the president of the American Pain Society, a man named James Campbell, gave an address urging doctors to treat pain as a 5th vital sign. Pain should be measured and treated at every visit, just like blood pressure, heart rate, temperature, and breathing. It sounded humane. It sounded progressive. And the American Pain Society, during Campbell's presidency, was receiving funding from Purdue Pharma. The concept spread fast. The Veterans Health Administration adopted it. Then the Joint Commission on Accreditation of Healthcare Organizations picked it up, the body that accredits hospitals across America. The Joint Commission published a guide on pain management. It was sponsored by Purdue Pharma. That guide told doctors that some clinicians have inaccurate and exaggerated concerns about the risks of addiction. Think about what just happened. A pharmaceutical company funded the medical organizations that created the standards. Then it funded the educational materials that told doctors not to worry about addiction. Then it sent its own sales reps into those doctors' offices armed with pamphlets, coupons, and a 5-sentence letter from 1980. The machine was running. Between 1996 and 2002, Purdue funded more than 20,000 pain-related educational programs. Conferences at resorts in Florida, Arizona, and California. More than 5,000 physicians, pharmacists, and nurses attended these events. All expenses paid by Purdue. Flights, hotels, meals, speaker fees. and the sales force was growing. In 1996, Purdue had 318 sales representatives calling on about 33,000 physicians. By 2000, they had 671 reps calling on up to 94,000 doctors. They nearly tripled the reach in 4 years. But here's where the math gets truly obscene. In 2001, the average salary for a Purdue Pharma sales representative was $55,000. The average bonus that same year was $71,500. The bonus exceeded the salary by 30%. Some reps earned bonuses of $240,000. In one district, reps made close to $1 million in bonuses in a single year. The total bonus pool in 2001 was over $40 million. Those bonuses were tied directly to how many OxyContin prescriptions their doctors wrote. The higher the dose, the bigger the bonus. Purdue tracked prescribing data by zip code. They knew exactly which doctors were writing the most scripts, and they sent their reps straight to those offices. They compiled lists of the highest prescribers and built their entire strategy around pushing those numbers higher. Their internal slogan told their reps everything they needed to know about the company's priorities. We sell hope in a bottle. And they handed out swag. OxyContin-branded fishing hats, stuffed plush toys, coffee mugs that said, "The one to start with," music CDs called "Get in the Swing with OxyContin," pedometers, luggage tags, beach towels, golf balls, Swiss Army knives. For a Schedule II controlled substance, a chemical cousin of heroin, the DEA later said the distribution of branded promotional items for a Schedule II opioid was unprecedented. A 2003 Government Accountability Office report called it an indicator of aggressive and inappropriate marketing. But the swag was just the surface. The real weapon was the coupon program. Starting in 1998, Purdue gave sales reps coupons for free OxyContin. A doctor could hand a patient a coupon, and that patient could walk into a pharmacy and fill a 30-day supply at no cost. In 1998 and 1999, each rep carried 25 coupons for a 30-day supply. In 2000, each rep had 90 coupons for a 7-day supply. By the time the program ended in 2001, approximately 34,000 coupons had been redeemed. Think about what a free 30-day supply of a highly addictive opioid does. It creates a patient who has now been taking oxycodone every day for a month, a patient whose body has adjusted, a patient who will need a prescription to continue. Internal Purdue data later showed that their discount and savings cards led to 60% more patients remaining on OxyContin longer than 90 days. They knew exactly what those coupons were doing. And when doctors started raising concerns, Purdue had an answer for that too. When a physician told a sales rep that patients seemed to be getting addicted, the rep had a script. The concern was documented in sales call notes. One rep wrote, "Doctor worried re-addiction with Oxy." The response was trained into them. OxyContin is long-acting, has fewer peaks than other oxycodone combos, less addictive value. Another rep noted, "Pushed hard on no buzz, less abuse." A third wrote that the doctor seemed to hear the oxy message better on no buzz potential. When a doctor said a patient was showing signs of addiction, asking for early refills, requesting higher doses, visiting multiple doctors, Purdue had a concept for that. They called it pseudo-addiction. The term was coined in 1989 by a doctor named David Haddix, based on a single case study of one cancer patient. One patient. Haddix argued that when a patient looked like they were addicted, they might actually be in pain that was not being adequately treated. The solution was not to reduce the opioids. The solution was to prescribe more. Purdue loved this concept. They marketed it to doctors, to medical boards, to policymakers. They told physicians that pain relief-seeking behavior can often be mistaken for drug-seeking behavior. If your patient looks addicted, they said, they probably just need a higher dose. And David Haddix? You know what happened to him after he invented the most useful sales concept in pharmaceutical history? Purdue Pharma hired him. He became a vice president of the company. By 2014, the concept of pseudo-addiction had appeared in 224 medical articles. Not one of them had empirically tested or confirmed that pseudo-addiction actually exists. 12 of those articles, including every single one that acknowledged pharmaceutical funding, were in favor of the concept. Nearly half of the papers that disclosed funding listed Purdue Pharma as the source. A researcher named Jane Ballantyne put it plainly: "There is no such thing as pseudo-addiction. It is a bad concept because it encourages people to give more opioids." Even one of its early proponents, a doctor named Lynn Webster who was affiliated with Johnson & Johnson, admitted in 2012 that pseudo-addiction became too much of an excuse to give patients more medication. It led us down a path that caused harm, and they knew. Purdue knew from its own clinical trials that OxyContin wore off before 12 hours in many patients. Before they even launched the drug, their studies showed that more than a third of women in early trials complained of pain within the first 8 hours. Half needed additional medication before the 12-hour mark. An independent study in 2002 by researchers at the Oklahoma University College of Medicine found that nearly 87% of patients prescribed OxyContin at a pain clinic were taking it more frequently than every 12 hours. Another study found that less than 2% of chronic pain patients said the drug lasted a full 12 hours. Nearly 85% said it wore off before 8. When the drug wears off early, the patient does not just feel pain returning. They feel the beginning stages of acute withdrawal, a powerful, consuming craving for the next dose. That cycle, a high dose followed by premature withdrawal, followed by desperate need for the next pill, is the textbook mechanism of addiction. Purdue knew this. Their own sales reps were reporting it. Doctors across the country were telling them, and the company's response was to send hundreds of sales representatives to, in their own words, refocus physicians on 12-hour dosing. One manager wrote to her staff that anything shorter needs to be nipped in the bud, now. They refused to change the dosing because the 12-hour claim was the entire business model. Without it, OxyContin offered no advantage over cheaper generic painkillers. Instead of allowing doctors to prescribe more frequently at lower doses, which would have been safer, they told reps to recommend increasing the dose. Higher doses, longer gaps. The exact formula for creating dependence, and the money was staggering. OxyContin sales went from $48 million in 1996 to $1.1 billion by 2000. By 2001, Purdue was spending $200 million a year just on marketing. By 2002, OxyContin accounted for 68% of all oxycodone sales in America. Over 14 million prescriptions were written in 2001 and 2002 alone. Cumulative revenue hit $35 billion. And now we get to the emails, the ones that were sealed in court for years, the ones that Richard Sackler never wanted you to read. In February 2001, as reports of OxyContin addiction and death were making national news, Richard Sackler, then president of Purdue Pharma, wrote an email laying out his strategy. "We have to hammer on abusers in every way possible. They are the culprits and the problem. They are reckless criminals." He called the people dying from his family's drug the culprits. In another email that same year, Sackler wrote to an acquaintance, "Abusers are not victims, they are the victimizers." That acquaintance had first written to Sackler saying, "Abusers die, well that is the choice they made. I doubt a single one did not know of the risks." Sackler did not push back on that sentiment. He endorsed it. He wrote that Time magazine's coverage of people dying from OxyContin was not balanced. He said the deaths were the fault of the drug addicts, not Purdue. He claimed that increasing sales made Purdue a target for sensational reports in the media, and he told his staff to continue to focus upon our noble mission. Noble mission. $35 billion. 500,000 dead. When someone outside the company suggested that calling addicts the scum of the earth might not play well publicly, Sackler acknowledged the optics problem. He wrote that if he were ambushed by 60 Minutes, he could not easily get that concept across, because calling drug addicts scum of the earth would guarantee that he became the poster child for liberals who want to distribute the blame to someone else. He did not say the concept was wrong. He said it was hard to sell on television. In a 1997 email chain, when Purdue's sales team informed Sackler that a major pharmacy benefit manager had raised concerns about OxyContin's abuse potential, Sackler dismissed the objection. He wrote that addiction may be a convenient way to just say no. He predicted that once the addiction objection was obliterated, they would fall back on the question of cost. He treated addiction concerns as a sales obstacle to be eliminated. The state of New York's lawsuit later alleged that in February 2001, Richard Sackler authored a strategy to blame and stigmatize their own victims. Connecticut Attorney General William Tong called the emails evidence of an utter disregard for human life, saying they encapsulate the depraved indifference to human suffering that infected Purdue's entire business model. And what happened? In 2007, Purdue Frederick Company, an affiliate of Purdue Pharma, pleaded guilty to a felony charge of misbranding OxyContin. The company agreed to pay $634 million. 3 executives, Michael Friedman, Howard Udell, and Paul Goldenheim, pleaded guilty, but not to felonies, to misdemeanors. They paid $34.5 million combined. Senator Arlen Specter called it a total disconnect. Federal prosecutors had wanted to bring stronger charges, but political appointees at the Justice Department, after a closed-door meeting with Purdue's legal team, which included former New York Mayor Rudolph Giuliani as an advisor, overruled them. Not a single member of the Sackler family was charged, and in the 5 years after that settlement, while Purdue continued to sell OxyContin, another 100,000 Americans died from prescription painkiller overdoses. You know what the Sackler family did during those years? They pulled money out. Between 2008 and 2018, the Sacklers withdrew nearly $11 billion from Purdue Pharma. They placed it in family trusts and offshore holding companies. They were draining the company while people were dying from its product. Purdue pleaded guilty a second time in 2020. This time, the criminal fine was $3.5 billion, with an additional $2 billion in criminal forfeiture. But by then, the money was gone. The company filed for bankruptcy. The Sacklers offered a settlement, pay a fraction of what they had taken, and in return receive immunity from all future lawsuits. The Supreme Court rejected that deal in 2024, ruling that bankruptcy courts could not grant legal immunity to people who had not themselves filed for bankruptcy. A revised settlement followed in 2025. The Sacklers would pay $7.4 billion over 15 years. They were barred from selling opioids in the United States. They gave up control of Purdue Pharma, and they kept billions. A wealth expert who was given access to the Sacklers' confidential financial records concluded their net worth was $10.7 billion in 2020. As of 2024, that number was $10.8 billion. They got richer while the settlement was being negotiated. The Sackler name used to be on the walls of the most prestigious institutions in the world: the Metropolitan Museum of Art, the Louvre, the Guggenheim, the Tate, Oxford University, Harvard, the National Gallery in London. Museum by museum, the name has been scraped off. The Met removed it in 2021. The Louvre covered the plaques with gray tape. The Tate, the Guggenheim, the British Museum, the Serpentine Galleries, all followed. The Sackler Library at Oxford was renamed. Photographer Nan Goldin, who nearly died of an OxyContin overdose herself, led protests on the steps of the Met demanding the name come down. She threw pill bottles into the reflecting pool of the Temple of Dendur in the Sackler wing. The names are gone from the walls. The money is still in the accounts. But here is the part that should keep you up at night. Everything Purdue built still works. The infrastructure is still there. The playbook was not destroyed. It was studied. The concept of pseudo-addiction was not formally abandoned by the medical establishment until well into the 2000s. Pain as the fifth vital sign was not officially dropped by the American Medical Association until 2016, 20 years after Purdue started selling OxyContin. 2 decades of doctors being trained to treat pain aggressively, to distrust their own instincts when patients showed signs of addiction, to prescribe more when every clinical signal said prescribe less. Nearly 100,000 Americans die from opioid overdoses every year. Not in the past, right now. The crisis did not end when Purdue filed for bankruptcy. It shifted. Patients who were started on prescription opioids and then cut off when regulations tightened turned to heroin. When heroin got expensive, they turned to fentanyl. Fentanyl now kills more Americans annually than car accidents. The pipeline Purdue built, from doctor's office to dependents, still feeds into that pipeline every year. And that is just one company. The playbook Purdue wrote, fund the medical organizations, shape the guidelines, train the sales force, give away free samples, invent concepts to explain away addiction, attack the victims, was copied across the pharmaceutical industry. Johnson & Johnson grew poppies in Tasmania to supply the raw materials for opioids and marketed them through its subsidiary, Janssen Pharmaceuticals. Insys Therapeutics bribed doctors to prescribe its fentanyl spray, and its founder was sentenced to 5.5 years in prison. Mallinckrodt, Endo, Teva all faced lawsuits, all settled. None of their executives went to prison for meaningful terms. The system Purdue built was not an aberration. It was a proof of concept. McKinsey & Company, one of the most powerful consulting firms in the world, helped Purdue shape its messaging from 2009 to at least 2014. McKinsey told Purdue it could increase prescriptions by convincing doctors that opioids provide freedom and peace of mind. They developed strategies to counter the emotional messages from mothers with teenagers who overdosed on OxyContin. Their proposed solution was to recruit pain patients to speak publicly about needing the drugs. McKinsey settled for $573 million. No individual consultant was criminally charged. Knowing all of this does not make you immune. That is the cruelest part. Your doctor still works inside a system that was shaped by Purdue's money. Medical education was warped by 2 decades of pharmaceutical influence. The prescribing habits, the attitude toward pain, the instinct to reach for the prescription pad, those were engineered. They do not disappear because a company went bankrupt. If you have surgery next month, there is a real chance you will be sent home with an opioid prescription. Not because your surgeon is corrupt, not because they did not pay attention, because the system they trained in was designed by people who made $35 billion selling the drug that prescription contains. You remember that medicine cabinet, the one in your bathroom or your kitchen, the bottle you forgot about. Someone made a commission on that bottle. Someone earned a bonus. Someone tracked your zip code and sent a sales rep to your doctor's office with a coupon, a pamphlet, and a 5-sentence letter from 1980 that had nothing to do with you. Richard Sackler called the people who got addicted to his family's drug reckless criminals. He said they were the culprits. He said they were the victimizers, not the victims. He said this while his sales reps were earning bonuses that exceeded their salaries, while his company was handing out free samples of a chemical cousin of heroin, while his own clinical trials showed the drug wore off early and created withdrawal cycles that mimicked the textbook mechanism of addiction. His family's net worth is $10.8 billion. They got you. Now you know how.